You know those headlines, the ones that just scream about the colossal costs of diseases? Billions here, billions there. You probably think those numbers are pretty solid, right? Set in stone. Well, today on the deep dive, we're cracking open the world of cost of illness or COI studies. We want to give you a shortcut to understanding what's really behind those figures. Okay, let's maybe unpack this a little. Our sources show that, researchers, policymakers, they really lean on these COI studies. They use them to describe healthcare spending, guide some pretty big decisions. We're talking about figures like, remember the over $117 billion estimated cost for obesity back in 2000, or like $92 billion in yearly productivity losses just from cigarette smoking. These aren't just numbers floating around. They actually drive policy discussions, intervention programs, that sort of thing.
Right. And what's really fascinating, I think, is how these huge figures are actually figured out. Our deep dive into the source material involved looking at a systematic review, basically, a
Yeah.
really careful survey of, well, all the relevant research published between 2000 and 2004, and uncovered something pretty surprising. Yeah. While these COI studies are clearly vital, there's often a startling lack of consistency and not much clear guidance in how they actually do the calculations. Their methodologies.
So a lack of consistency.
Exactly. And this raises a really important question for you listening. If there aren't well-accepted standards, how can anyone, policymakers, the public, truly trust these numbers? How can you compare them when they pop up in headlines?
That's a huge point about trust. So, okay, digging in a bit more. What are these specific issues? What makes the numbers potentially unreliable?
Well, it often starts with the very definition of cost. Seems simple, but it's not. Imagine seeing that multi-billion-dollar cost for a disease in a headline. You'd assume it's a solid, agreed-upon figure, wouldn't you?
Yeah, absolutely.
But our sources show that often it's maybe more of an educated guess. It can shift wildly depending on how cost is defined.
How so?
Well, is it the provider's charges, what they actually bill, or is it the actual reimbursed amounts, what insurance companies or patients really pay out?
Ah, okay. Big difference.
A huge difference. That seemingly small detail can swing a cost figure by billions. And that means policy decisions might be based on, frankly, incomplete data. It's kind of like trying to compare the sticker price of a car to what someone genuinely paid after negotiations. Very different numbers.
Right, right. So it's not just about what cost means, but also what's actually counted in that cost. Is that part of it too?
Exactly. You hit it. And this is where it gets really interesting, I think. Many studies only look at a limited set of what we call components of care.
Components of care, like doctor visits.
Precisely. Doctor visits, hospital stays, prescriptions, physical therapy, maybe even long-term home care. All of it.
Mm.
But our review found the average study only covered about 4 components. 4.
Only 4. Wow, that seems low.
It is. And it means they're seriously underestimating the full economic hit. It's like trying to budget for building a house by only counting the bricks and completely forgetting the roof, the plumbing, the electricity. You just don't get the full picture.
Okay, that makes sense. So if the numbers themselves are shaky because of definitions and what's included, what about where the numbers even come from? The data sources.
Yeah, you just touched on another key challenge there. A lot of these studies rely on proprietary data sets.
Meaning private data.
Exactly. Private, limited information. Think private insurance claims data, or maybe data from just one specific hospital system. It's like trying to understand the entire healthcare system by peeking through one tiny keyhole.
So it's hard for others to check the work.
Very hard. It makes the findings difficult, sometimes impossible to replicate, because nobody else can access that same data. Oh. And crucially, their conclusions aren't always generalizable. They might not apply to the broader population, especially people who are uninsured or maybe have different kinds of insurance coverage. And if you connect this back, that massive $117 billion obesity cost we mentioned, it might actually be far higher, maybe even double, if you properly factored in all the hidden costs, indirect expenses, and the impact across everyone, not just those in the specific data set.
Wow, okay. So this all paints a picture of, well, some significant challenges. But what does this mean for making these studies better, more useful, more reliable? Our sources did offer some recommendations, right?
Absolutely. And that's the good news here. Solutions are definitely within reach. Standards are urgently needed. And our sources actually outline what good standards should include. First, transparent disclosure of the study's perspective.
Perspective, meaning?
Meaning, whose cost are we talking about? Is the study looking at costs from the patient's point of view, like what they pay out of pocket? Or is it the insurer's view, what they reimburse? Or maybe society as a whole, which would include things like lost work productivity.
Ah, okay. Each angle gives a different number.
A vastly different number, yet each one is valid in its own way. So you need to be clear which perspective you're taking. Second, studies really need to include all the relevant components of care, not just pick and choose a few. Get the whole picture. Third, researchers need to clearly describe their data sources and, crucially, whenever possible, use publicly available data sets.
To help with that replication problem.
Exactly. For better replicability, more transparency, this allows for much more accurate comparisons between studies and leads to genuinely informed decisions.
So for you, listening to this isn't just some academic debate, it's quite practical. The next time you encounter one of those big statistics about the cost of an illness, remember to ask some questions. Ask, what perspective is coming from? Patient, insurer, society. What components of care does it actually include? Is it just hospital stays or more? And what kind of data was used? Was it private data or something more public and verifiable? These questions really help you cut through the noise, to properly evaluate the information you're getting. Just consider how a number that seems so simple, the cost of a disease, can actually hide this whole world of methodological complexity, and how understanding just a bit about those complexities really empowers you to be a truly well-informed citizen, ready to ask the right questions.